So, good morning, good afternoon, and good evening. This is the 355th day of continuous Zoom session of International Forum for Promotion of Homeopathy. So, before starting the proceedings, let us have a silent prayer for 1 minute. Thank you. Today's our chief guest is Dr. Khushali P. Gambhir. She will present a topic on homeopathy, management of menopause transition, a basic protocol. The description is a lot of things to say about her, so I am not going to the detailed description of Dr. Khushali. Will convince when hearing her topic, I hope. So on behalf of IFPH, I am welcoming Madam on the platform. You can present your topic for the next 40 minutes, then followed by a discussion from our participants. So now the platform is yours, Madam. Please proceed. Thank you. You can unmute yourself from.
Okay. Namaste, and thank you for having me over on this prestigious platform. First and foremost, I need screen sharing rights.
Yes, I think you are provided. You can proceed.
Yeah, okay. Yeah, I think the screen is visible now to everyone.
Yes, started.
Yes, all right. So this is a very pet topic of mine, and thank you for giving me this opportunity today, everyone, and I look forward. So this is about, I'm going to speak about the homeopathic management of menopause transition and trying to create a very basic protocol. And I will be enlisting why and how this thought process came up. So, just a moment.
Okay.
Just a moment. So one of the most important things from around 25 years now with practice, something that I started noticing was that we needed a protocol. We needed something for quick intervention. And that was what made me think about it. So let me just highlight the thought process first and foremost in understanding menopause itself. Yes, it is a phase of loss of fertility, but more important than that, it is the onset of aging and non-communicable diseases. That would be the most important thing to bear in mind at this segment of life. The definition of menopause is 12 consecutive months of amenorrhea. I'd like to highlight this for the simple reason is many times patients reach out to us and then they say, you know, I've menopaused. It's 4 months that my periods are not coming. But it is 12 consecutive months of amenorrhea that constitutes menopause. Menopause transition, or also known as the climacteric phase, is a phase of a multitude of symptoms, very different symptoms. Some are functional, but some can be with advanced pathology. What is interesting to note over here is that it has a lot of mixed miasms, but the soric manifestations are very high because of the hypersensitivity of sora itself. Lifestyle and environment play an extremely important role in the evolution and in the maintenance of symptoms. And menopause distress can be very severe to those who go through it. Both miasmatic and non-miasmatic symptoms are present. Left untreated, the symptoms can really become worse. It is very, very interesting to understand that menopause transition is truly a different experience for every woman. And even for the same woman, each month can be a different transition throughout the transition period. A protocol is a method which should be followed to control a certain disease. And so, in the early stage, this polluted soil needs to be rectified with anti-miasmatic treatment to ensure a trouble-free transition. So I did this study in my clinic, and the main aim of it was to evaluate the scope and limitations of creating a protocol for menopause transition. It is a phase of high variability of symptoms and lots of suffering. Quick intervention is thus needed through few drugs capable of covering most symptoms and concomitants. Recognizing the important parameters throughout menopause transition and checking progress through homeopathy. Few parameters like endometrial thickness, stress, insomnia, vasomotor flushes are visible very early in the menopause transition. The menopause transition per se is a time of midlife, 40 to 60 approximately. And this is a time of a lot of non-communicable diseases coming up. And it is at this time that these little parameters of endometrial thickness, insomnia, vasomotor flushes give rise to other more serious illnesses coming in. So the key factors in the OPD to keep in check is first and foremost the endometrial thickness. Pre-menopause, it has to be less than 5 mm. Post-menopause, less than 4 mm. Other various factors creep in during this phase due to the waning estrogen and the progesterone. So PCOS is common at this time. Ovarian cysts, cervical erosion, hypertension, diabetes, hypothyroidism, metabolic syndrome, obesity, mental health, breast health, all come in at this time, and it is extremely important to keep a check on these. It is important to prevent anemia. So a lot of women come with menorrhagia and heavy bleeding and can become extremely anemic. So recovery from something becomes delayed. Urogenital health is an extremely important factor at this stage again. Stress and urge incontinence, these are not spoken of by many women until we ask for it. Hemorrhoids, fissure in ano, leukorrhea, and vulval itching. All of these present through this time. Bone health is of extreme importance. Osteoporosis comes in post-menopause, and it is important to prevent injuries. Again, simple scenarios when women go through urge incontinence, they rush to the toilet, they are osteoporotic, and then the fracture happens. So these are little things that we need to be very, very alert and keep a check on. So what led to the formation of a protocol? What were the concepts behind? I think no better phase than the current scenario of genus epidemicus that we are going through. Everyone is familiar with genus epidemicus and concomitants. Now, the organon has spoken of the genus epidemicus for acutes in aphorism 101 and 102. But aphorism 103 and 104, these speak of an insight on the phenomenon of a disease and sora, and I request the others to concomitants. Concomitants are characteristic symptoms. We are all familiar again with concomitants. Mental concomitants have always been the best concomitants, more so if they are newly present. So now looking at the protocol formation is a combination of aphorism 103 and concomitants. The Indian Menopause Society has their clinical practice guidelines, where they state in these guidelines the vasomotor symptoms, urogenital symptoms, and the menstrual irregularities all are linked with estrogen levels. But here we have a long list: muscle and joint pains, vertigo, palpitations, paresthesia, mood changes, depression, insomnia, nervousness, formication, decline in sexuality. All of this is associated with menopause or this midlife segment, but do not necessarily correlate to estrogen levels. Hence, these become extremely important concomitants for us homeopaths. So the biology and the symptomatology of menopause is truly blurred because of its relationship with the underlying aging process. There is new symptoms present in this phase. Mental symptoms are widely present, and they make extremely good concomitants. The aphorism 103, which speaks of psora predominantly, highlights the wide range of symptoms and seen over a large number of individual cases. So it gives a large range of medicines to help these. Menopause transition is a wide variety of symptoms, and each becomes a concomitant to the other. The intensity of the symptom will qualify it. This study was done sheerly out of curiosity in my own clinic in Chennai. 150 cases, they were selected at random to identify the common presentations seen in my clinic. From them, 30 cases were selected again at random from the 5 most commonly presenting conditions through the transition phase. The inclusion criteria were women whose age was between 40 to 60, that is the years of midlife. And the inclusion was patients with suspicious or confirmed malignant cases. Observation time, they were followed up once in 30 to 60 days for approximately 10 follow-ups. Investigations, wherever possible, investigations were done to confirm normal pathology. Diet and regimen was emphasized. All patients were explained, educated about the importance of a good diet. There were a few limitations to this study, not few, quite a number. The study was really done out of curiosity, only to assess the most frequent presentations of menopause and their response to a group of remedies. There was no control group. Some patients did not follow up with investigations. Some patients wished to discontinue the treatment once their presenting complaints were better. Standardized questionnaires were not used for all cases. I'm going to run through a few cases which will highlight the different factors I've just spoken about. So this is Mrs. X. I have changed the names. I kept it standardized since this is an era of virtual era where access to all information is free. So Mrs. X was 52 years. She met me in March 2017 with hot flushes. Her hot flushes, her complaint, lots of hot flushes with palpitations, followed by sudden coldness and perspiration, especially around the waist and below. She was very irritable when hot flushes came on. Since 2 years, she had irregular menstrual cycles. Her last menstrual cycle was January 2017. Her sleep was disturbed due to frequent night micturations. Other symptoms were bloating, weight gain, hyperlipidemia. She's already on statins. So this lady, she had a very interesting follow-up. She met me, as I said, in March 2017. She was treated with amyl nitrosum 30 for 1 month. I had asked her to get her ultrasound done, surely because of her age of 52. Her ultrasound was done on 17th of March, and her endometrial thickness was 3 mm. So she was within the safe range. She was given amyl nitrosum on 7th of March, and on 13th of April, she got her menstrual cycle. And her hot flushes became better. On 17th of August, she met me again with lots of hot flushes and burning. Again, she was treated with amyl nitrosum. On 8th of September, she got her menstrual cycle and again followed by no hot flushes. Once again, January 2018, she met me with a lot of hot flushes. At this time, she said, I don't remember whether she had a menstrual cycle or not. In October 2017, the patient was not sure. Nevertheless, I gave her amyl nitrosum 30, surely because she has responded to it. Sure enough, 27th January, she had her menstrual cycle followed by no hot flushes. Thereafter, she met me again in July with a lot of hot flushes and palpitations. At this time, she was undergoing a lot of stress because of her family wedding, followed by her own son's wedding. Her sleep was poor. So she was kept on amyl nitrosum 30 twice a day for 5 months because she had back-to-back weddings in the family and her son's wedding. This time, her hot flushes were better, but not gone till she got her menstrual cycle in September 2018. And then her hot flushes disappeared. Once again, she met me in February. Her son's wedding got over in December. She met me in February that the hot flushes had increased and the insomnia was severe. I repeated the same medicine and the hot flushes got better, but this time there was no menses. In March, she mentioned to me the hot flushes and the sleep were better, but she was feeling very depressed and constantly felt like crying. It was at this stage that I changed her prescription to Pulsatilla 30 for a month. So thereafter, there have been no further hot flushes. Her last menstrual cycle was September 2018. Her sleep has been good. I still decided to get her ultrasound done in 2019. Her endometrial thickness was 2 mm, pap smear, mammogram, all normal. Uterus was 5.3 centimeters. So she was well within the safe range. So homeopathy helped her transit into a good, comfortable menopause. These are some of the references that I took, which were straightforward references. And the Materia Medica references were most encouraging, where Borix Materia Medica has clearly mentioned on inhaling this drug, it rapidly dilates arterioles and capillaries, producing the flushing of the face, heat and throbbing in the head, superficial arterial hyperemia, palpitations of the heart, and similar conditions cured by it, especially the flushing and other discomfort at climacteric. So this was a huge guiding point for me. Adolphe Lippi has also mentioned, for the nervous, sensitive, plethoric woman during or after menopause, flushing starts from the face, stomach, various parts, followed by sweating, often hot and profuse. Abruptly limited parts are icy cold. So what I noticed when I saw this patient was that the vasomotor symptoms responded beautifully to amyl nitrosum 30. Post-administration, she would develop a menstrual bleed. That gave relief to the patient. It prevented the endometrial thickening and thereby facilitated a smooth and uneventful transition through menopause. As one phase of the flushes was getting better, weepiness developed, calling for another remedy. This is what I mentioned, that the same lady can go through different symptoms through this transition period. My next case is that of depression and hot flushes post-panhysterectomy. She met me when she was aged 46 years in November 2017. Her chief complaints were she came with a lot of weeping, depression, didn't want to meet anyone. She did not tell anyone of her hysterectomy except her husband. I mean, those are familiar with India, we know that it's a family decision often. So she never told anyone. She would control her tears in front of her husband also. And she kept on asking me, was hysterectomy needed? Why were my ovaries removed? Was there something more to worry? Hot flushes with profuse perspiration, burning and waves of heat rising up. Her medical history was very interesting. She was a known case of deep vein thrombosis. She had fibroids and she had a lot of menorrhagia due to blood thinners which was given for her deep vein thrombosis. She was being deep vein thrombosis. Because of it, she cannot go on to hormone therapy. So she had no other alternative but to go for hysterectomy. She did not reach out to homeopathy earlier. I wish she did. During surgery, the ovaries had adhesions and thus a panhysterectomy was done on the table on 22nd October 2017. She met me in November. So the patient was treated for her emotional state. Since she came with a lot of weeping and crying and depression, I gave her Natramure 1M based on her tendency of being such a close person and in infrequent doses. I gave her Pulsatilla 0 bar 3 double dilution twice a day with her BPness and the history of deep vein thrombosis for her emotional state. For her hot flushes, I needed to think further, and eventually Lachesis 1M and Biscum album 30 were given for the hot flushes. Now, she responded within a month and her emotional symptoms, but her hot flushes took 5 months to settle. Truly, when she came in with so much of mentals, and when I handled the mentals and she responded within a month, I never expected any of the hot flushes or the physical symptoms to even stay. She did not respond to the usual medicines of amyl nitrosum or sepia or jabarandi, but finally settled with Viscum album 30. What guided me was the description of wave of burning like fire rising up from the legs. I'd like to quote this reference from Borix Materia Medica, Viscum album climacteric complaints, and a glow rises from the feet to the head, seems to be on fire. Out here, I definitely would like to bring into picture a discussion which long time back I was privileged to have with Dr. R.P. Patel, late Dr. R.P. Patel from Gujarat, from Kottayam and then Gujarat. He had once mentioned a case of his, of epilepsy, and the aura was this glow from the feet. And he said in Viscum album, nowhere is it written that there's aura or epilepsy. You have to, it is just written under extremities. But he said, as a homeopath, you have to think beyond and use these as concomitants. And that's how, to me, that reference helped me, guided me to Viscum album. My third case is that of insomnia. Again, the patient met me at the age of 48 years. Sorry, the date I've not mentioned here. Her insomnia started since 1.5 years. She was unable to fall asleep and she would get a lot of old thoughts. Sometimes there were hot flushes. She had a lot of menorrhagia and was considering hysterectomy. She had irregularity of menstrual cycles since 2 years. She also had a lot of painful boils all over the body. She was extremely anxious on her own health and family's health. Of late, she was very, very hurried. She wanted everything completed immediately, even as she's explaining it to someone. So eventually she said, while I'm explaining, I would do it myself. That she said, because she would find others too slow to comprehend what she's trying to say. She was very loquacious and she would drift in conversation and she kept on needed guiding back. Her family history was that her mother went through hysterectomy and she had a hypothyroid state, her mother. Father had ischemic heart disease. Now, because her mother had her hysterectomy, the patient had already decided that she was going to have a hysterectomy for menorrhagia. She said, post-hysterectomy, already my sleep is so bad. I've heard that post-hysterectomy, it gets very severe. So I've come earlier. I'm going to get a hysterectomy done. I'm planning it in the near future. There's nothing remarkable in her physical generals, except that she had developed an aversion to citric fruits. Now, Lachesis 1M was given to her fortnightly once. And for her bleeding, Sabina 30 was given 4 times a day till better whenever there was menorrhagia. The patient stayed on the same prescription from November 2015 to 2017. Lachesis 1M fortnightly once, followed by Saclac. Whenever there was menorrhagia, Sabina. When I met her, 2015 was the date of presentation. So when I met her, in November, she had her 2015. She had a bulky uterus and the endometrial thickness was 10 mm. Like I said, a premenopausal woman would ideally be less than 5 mm. And after treating her in July 2016, her bulky uterus and the fibroid were the same, but her endometrial thickness reduced from 10 mm to 6.6 mm. In March 2016 onwards, the patient stabilized in her menstrual regularity and her sleep. By June 2016, her iron supplements that she was taking from November 2015, so almost 1.5 years, was stopped because her menorrhagia had stopped and her hemoglobin had touched 13.9. So she stopped her iron supplements. In July 2016, she reported that she sleeps very well. She reported to me in November 2015. By July 2016, she said, I'm sleeping very well, sometimes excess. If in deep sleep, she takes time to wake up as she feels the eyelids heavy. I continued the same medicines. Her final menstrual period was on 28th of October 2016. Now, she was maintained with lachesis till 1 year post the final menstrual period. That is, till October 2016 was the final menstrual period. She was treated till 2017. As I said, 12 consecutive months of no menstrual cycle is menopause. So till she reached that milestone, she was maintained. Her general condition improved, her endometrial thickness improved. Lachesis was clearly a clear-cut selection on the mental concomitant of loquacity and the hurried nature. The bulky uterus and fibroid did not reduce. However, it does stand a possibility post-menopause to come back to normalcy. Lachesis helped not just the insomnia. She came for insomnia, but she got her menorrhagia also settled with the same medication. And again, she transited through a normal menopause. So friends, this is something that I want to highlight. Lachesis has guided me and helped me tremendously in transiting women through menopause. Again, if I have to quote the Materia Medica by T.F. Allen, this was a very important reference. Sleeplessness, wide awake before midnight, late falling asleep, difficult falling asleep, was several times unable to fall asleep. Heavy morning sleep, gets up unwillingly. This is a curative action, which is something that she had mentioned in July 2016. Because of this reference, I did not change any medication. I stuck to the same medication because of this particular reference. Again, Boric has a lot on the insomnia for lachesis, great loquacity, derangement of time sense, sleepiness, wide awake in the evening, sleepiness but cannot sleep. Again, with references from the repertory, again, lachesis and belladonna closely come together, but lachesis has always been helpful through menopause transition. And my last case is that of anxiety, headaches, and hypertension. This is a case which is pretty long. It's a 6 years follow-up, so I have really concised it and given key salient features like I've done for the others. She met me in 2013. She was 45 years at that time. Her chief complaints was since 1.5 years, anxiety, depression, fear of unknown and negative thoughts. Now, her 12-year-old daughter had convulsions 1.5 years ago, and since then, the anxiety and depression started. Her sleep is poor, and she would keep waking up to check on the child. Lots of palpitations with anxiety, frequently headaches were frontal and temporal. She was recently diagnosed as hypertensive, and she is currently on metoprolol XL, 50 milligrams per day. Her menstrual cycles have been irregular since 1 year. Now, her family history was that her mother had breast cancer. The nature of this patient is she was very close and she won't share emotions unless prodded. Very sociable, desires company, very sentimental, will cry in movies openly, but with emotion, she will bottle it up. Always hurried, anticipates the worst when it comes to health. Always been worried about the health of self and family even before the daughter's incident. Her husband is a healthcare professional. Now, her first visit reports were on 11th of July 2013. Her LH was 43.2, FSH 32.7. So she's heading into the menopause transition. She responded to different medicines like argentum nitricum 1M, Cratagus 30, 200, Ignatia 200, Oromet 200, 200, each given at different times. I will explain when and how. Intercurrents used were lachesis 1M, staphysagria 1M, and glonoine 200. Now, argentum nitricum. Argentum nitricum was predominantly used whenever she presented with anxiety, palpitations, and diarrhea. Cratagus was given to control her BP. Ignatia was given whenever there was anxiety and depression. Aurum-met was whenever there was depression and BP fluctuations. Lachesis was given whenever the menses were erratic and stopped in 2016, anxiety and BP fluctuations. So whenever there were lots of fluctuations is when lachesis came in. Staphysagria, she went through a phase of a lot of emotional suppression. That was the time staphysagria was used. And glonoine was given to her for sun headaches between 2017 and 2018. Then after her menstrual cycles had stopped. Her cycle stopped in 2016. So the medicines were each given. My method is to follow up once in 30 to 60 days. So based on the presenting symptom at that time, one of these medicines were given at that time. Sometimes it would be an argentum nitricum single dose and then followed by cratagus regularly or followed by ignatia, depending upon what she presented with. Now some notes on a lot of her lifeline. In 2016, January to August, her BP was 140 by 100 mm of Hg and then came down to 120/90. Her twin children were giving 10 standard boards. So the child who had the epilepsy was a twin child. So she has totally 3 children, 2 twins and 1 older one. Now, there was also a financial strain as some money got stuck in an apartment which was not getting completed in this year of 2016. Her menstrual cycle slowly became erratic and scanty and stopped by end of 2016. By 2017 to 2018, she suffered from lot of sun headaches, migraines. 2018 to 2019, she shifted to a new apartment. She took 10 months to adjust to the new environment. She had lots of pent-up emotions in this pain during this time because she had a quarrel with her sister, as her sister got burnt in a gas cylinder burst during her housewarming ceremony. The reason I'm emphasizing all of this is because many things happen between the age of 40 to 60. We can look at this as an anxiety case. We can look at it as a hypertensive case. We can look at it as whatever we want. But the crux of homeopathy is the individual is one. Individualization in the individual is a single unit. And their environment can be varied and we work towards that. And hence, this case is a long follow-up, many years, hand-holding through her menopause transition years. Her journey with metoprolol for her BP was, as I said earlier, she was 150/100 when diagnosed in 2013 itself. And when she came to me, she was stable at 139. And she was on 50 mg of Met-XL once a day. In 2014, Met-XL was reduced to 25 milligrams by her physician as the BP was stable at 130/80 or 120/80. In February 2015, Met-XL was reduced further consultation with a physician. The general physician was not happy, but the patient requested it alternately. In March 2015, Met-XL decreased to weekly twice after consulting with me. BP was stable at 120/80. Emotionally, she was stable. In January 2016, Met-XL was decreased to weekly once. Her general physician advised her to stop it, but the patient refused to do so. She was very anxious. As I said, 2016 was a year of a lot of anxiety. Her children were going through their board exams. There was a financial crunch. That apartment didn't get over. So she was going through a difficult time, emotionally tough year for her. In 2018, the patient was confident to reduce Met-XL further to once in 2 weeks and then stopped it by August 2018. Her BP is stable at 120/80 or 110/70 till date. She still comes with her older daughter to me. So this is just that post-menopause. There is a lot of changes in the estrogen and the androgen ratios in the body. There is increased BMI, there is endothelial dysfunction. There is a lot of activation of different systems leading to hypertension. This is a gateway to get non-communicable diseases, and our intervention has a huge value. Patient still visits on and off. She is emotionally stable, well adjusted to the new environment, and her BP remains within normal limits. For this patient, I use the green climacteric scale. The first visit, we took the symptoms of heart beating quickly, strongly, feeling tense, nervous, difficulty in sleeping, attacks of anxiety, panic, unhappy, depressed, headaches, muscle and joint pains. Her score was 18 on the first visit. This is a chart where we can see her score. When she came in 2013, 2014, you could see that her green climacteric scale was at 18. Slowly with the treatment, she came down, stabilized at 3, went in April 15 when she was good, emotionally good, all fine. It was at 0. And then as 2016 came with the board exams, we can see this fluctuation in her whole lifespan between the latter bits of 2015 to 2017. And then again, she started to stabilize. And by the time I ended this whole survey, she was at 4. So there were different observations that I got to know from this little study of mine. 5 different types to be precise. The age distribution was typically the cases presented. 49% of the cases came in at 40 to 45 years of age, and 28% reported between 45 to 50. And thereafter lesser. The most common presentations seen were actually hot flushes, followed by constipation, anxiety palpitations, menorrhagia, and insomnia. There were many remedies which came in, but 4 remedies clearly had a very high incidence of civillimum. Lachesis being 53 of the 53, pulsatilla, calcarea carb, and amyl nitrosine. The top 4 remedies coverage of presentations were such that lachesis for menorrhagia covered 47% of the cases, pulsatilla 34%, calcarea carb 14%, and amyl nitrosine 7%. Insomnia 33% of the lachesis and 27% of pulsatilla. Anxiety palpitations, again, lachesis 27%, pulsatilla 10%, amyl nitrosine 10%. Hot flushes 57%, lachesis, amyl nitrosine 33%. And constipation was pulsatilla 23% and lachesis 13%. This is a more interesting perspective from the remedy perspective. Looking at lachesis as an individual, we saw that it really helped a lot in hot flushes and in the menorrhagia and with insomnia. So when these are the criteria coming in as concomitants, each becomes the other's concomitant, we saw lachesis coming in. When it came to pulsatilla, there was menorrhagia and there was constipation. In pulsatilla, there's another important factor in the menorrhagia. Usually pulsatilla has been associated with amenorrhea, but that's precisely the fact that during menopause transition, there is phases of amenorrhea going to happen. And with that phases of amenorrhea, and then the endometrial thickness increases, and then there is menorrhagia. At this junction is where pulsatilla was helping, especially if the person had constipation and insomnia. Calcarea carb helped tremendously with menorrhagia, and amyl nitrosine with hot flushes. Hot flushes and also with insomnia because of the hot flushes. So if I went through the diagnosis perspective, of the 150 cases, there were 22 different diagnoses that came up. but the topmost were the hypothyroid and the fibroids. And the miasmatic understanding, when I worked it out, was that predominantly it was SORA and psychosis. So this highlights the same fact that we are all very familiar with, that homeopathy has a very wide therapeutic range. I've had 13 cases of hypothyroidism, calcarea carb, and amyl nitrosum covered 5 cases, pulsatilla. Nitrates where lacus covered 7 cases, calcarea carb 2, pulsatilla 1, amyl nitrosum 3. So immaterial, where whatever be the diagnosis, immaterial, because homeopathy has that clear advantage. It shows the wide therapeutic range of homeopathic medicines during this menopause transition. So the results were determined as follows, based on 30 cases of each. Improvement was symptoms were better in frequency and intensity, but the pathology remained. Cured where symptoms also disappeared and the pathology was also better. The same was the symptoms and the pathology all remained status quo, and deterioration were when symptoms were aggravated. So here we saw that in menorrhagia, going by all of this, there was improvement for menorrhagia in all of it. The total improved was 61%, cured were 19%, same status quo was 19%, and deterioration was 1%. Only in insomnia we saw deterioration for 2 cases, which was 7%, if I calculated. So basically, we noticed that the improvement in the cured were very high. Now, a relationship of age and response. In all the 5 presentations, the best response came in that same 40 to 45 and then 46 to 50. So the first decade of the menopause transition, 40 to 50, we had the best responses. And which is why I would highlight the fact that that early intervention was what made me say that if this person has to revert and come back to normalcy, it has to be done early. So the similum, incidence of the similum from the different drug remedies that came up, there were actually 58 remedies. The top 4 were clearly high and covering most complaints. The results table showed that there was a very high scope of homeopathy in menopause transition, with 61% of improvement and 19% of cure, so totally 80% of a positive response. The age and response tables show that the best results are between 40 to 45, followed by 46 to 50, highlighting the fact that that early intervention is extremely essential. A stitch in time saves 9. The miasmatic understanding of the diagnosis, there were different diagnoses seen during menopause, and it is predominantly SORA and psychosis that we saw in the various diagnostic criteria. The miasmatic understanding of the remedies, of the 4 main remedies, lacus, pulsatilla, and calcarea carb, were anyway 3 are polycrests. Lacus being more psychotic, syphilitic, and calcarea carb, pulsatilla more soric and psychotic. Smaller remedies, the cases and the study show that small remedies like amyl nitrosum and viscum album have an equally large role to play in the management of menopausal symptoms. Now, coming back to concomitants, aphorism 103 and protocol, we have understood that there's a wide range of symptoms. Each symptom is a concomitant to the other. And one can get lost in this wide supply of concomitants. There is genuinely a very wide supply in this case, and it can be extremely confusing. Study has shown that some medicines had a higher affinity to cover more symptoms than concomitants. Thereby, the thought process of a protocol came up. We also noticed that in patients suffering from anxiety, hot flushes, and insomnia, this was like a trio. This was commonly seen. And this was seen in patients who had a predisposition to anxiety in the past, and it would heighten all the symptoms. So if we have to understand the aphorism 103, understand SORA from many single patients. Antisorics are remedies of several patients studied. The menopause transition is a wide variety of symptoms. The same individual can have different individuals can have a wide range of symptoms. Hence, we need widely applicable remedies to facilitate a quick intervention. I'm just going to quickly read certain salient pieces of aphorism 103 from the Organon. That while 103 we are familiar that it is usually used, genus epidemic has been used in epidemic diseases which are generally of an acute character, but the miasmatic chronic maladies, which as I have shown always remain the same in their essential nature, especially SORA, must be investigated as to the whole sphere of symptoms in much more minute manner than has ever been done before. For it is then also, for in them also, one patient only exhibits a portion of their symptoms. So again, one menopause patient will exhibit some portion of their symptoms, or 1 month will be one portion and another month is another portion. Just like SORA. One patient exhibits a portion of their symptoms, a second, a third, and so on present some other symptoms, which also are but a portion of the totality of the symptoms which constitute the entire extent of this malady, so that the whole array of symptoms belonging to such a miasmatic chronic disease, especially SORA, can only be ascertained from the observation of very many single patients affected with this chronic disease, and without a complete survey and a collective picture of these symptoms, the medicines capable of curing the whole malady. And these medicines are at the same time true remedies of several patients suffering from such chronic affections.
Yes, doctor.
Thought process.
Okay, now I've finished.
Yes, I'm finishing, sir. Just a moment.
Okay, okay. We have the discussions.
For every woman, it is important to transit safely, emotionally, physically, mentally. Early intervention is quick results. Certain remedies have a better, higher aspect of handling them, and it's the basis of control. Of the protocol. Lots of research is needed. Yes. I'm happy to share the Menopause Society's recognition for my work, Homeopathy for Menopause Transition, and I have been invited by them to speak on metabolic syndrome. They were again facilitated me and recognized my work for homeopathy for mental health through menopause transition in their national conference, and was again invited to be part of their panel for independent at 80. I have spoken about this topic on different platforms. Thank you, IFPH, for this beautiful opportunity.
Yes.
Thank you.
Very nice presentation, madam. Congratulations for your presentations. Now we have the discussion part. Those who are interested to participate in discussions can go to the participant list and raise their hand, please. Yes, we have witnessed a true professional presentations, especially the case taking, the case analysis, the investigation of the case, especially the pap smear test, the mammograms, very professional. Then about the statistical analysis was excellent. It's a very good presentation. Also, the discussion was last one, very excellent. It proves the importance of each and every medicine in different areas. The sphere of action is very important. It's always a nice presentation. Now, those who are interested to participate can please go to the participant list and raise their hands. So I think what is more important is that this is a very important topic because the society needs help from homeopathy. That proves. Of 159, 50 cases, we have 58 medicines. That's very important.
Yes.
But no other system, I think, can provide this much of medicines. Not only drugs, but medicines, well-proved medicines, so that we can. So it's a very important. It gives a message, I think. We can help the society of different strata of society in children, adulthood, then the old age patients, the geriatric cases, the menopausal complaints, so many complaints, then the learning disorders, so many different strata can be helped with homeopathy. So it is up to the society. They have to decide to accept it or not. That's a problem. So Dr. Shadi Kudiyat, what is your opinion, doctor?
Yeah, thank you, Dr. Khushali. You made a very wonderful presentation with a very short notice. We thank you for this, for your available availability and coming forward with a very nice presentation. And regarding the presentation, so please mute Abel, please mute all. And regarding two important signs and symptoms we notice in menopause is one is fibroid and second one is hypothyroid. These two are connected with the philosophy of thinking of the world going on today. That's why menopause is a natural thing, used to happen without much complications in regular life, is getting to a problematic phenomena, which is a natural event, is getting into an unnatural suffering event nowadays. So the philosophy of thinking that the world is leading today is contributing to that. That is making women to a level of unnatural thinking and living. But we cannot do anything about it. At the same time, we should be aware about it, because as Hahnemann mentioned, along with the giving medicine, identification and rectification of the fundamental causes that produce the problem is also important, so that a permanent cure will be achieved. I think all of us can take note of these things. The fibroids are usually coming with the authoritative toughness of mind. Usually a feminine character is softness, smoothness, flexibility, and tenderness. When the mind knowingly or unknowingly get into a tough situation, which is a kind of loss of femininity happens, that can affect the female specific organs, most especially uterus, especially at the menopause level, that usually happens, and that is contributing. And when the nature of thinking and functional abilities is going to a troublesome situation, sadness and depressions follow. And the society demands much from women today, and sometimes it is beyond the natural level. So that further stresses that lead to physical complaints also. So an awareness of all these things can help us manage and educate menopausal women and lessen the suffering, is my opinion. Thank you.
Dr. Kanesh, Dr. Kanesh, please. Please unmute Dr. Kanesh.
Good evening, all. It's a very good presentation, Dr. Khushali Gambhir. Really speaking, this is one of the area where we need to concentrate more and more, because we are getting a lot of cases during menopause. Today also I got a call from a lady. She was having menses after 4 months of cessation. So she told me that she wanted to know, doctor, I was having severe hot heat all over my body, and what is the problem with me, and whether I take some medicine or not. What is your idea like that? Actually, this is a condition. We used to say that hot flashes are coming during menopause. This is one of the area that we are getting. One of the topmost remedy here is lactasis, as everybody know, and actually she was having some psychological problem because of she was suffering from depression due to her lack of support from her husband. And he was a police officer, and her she is also working in the same field, but they didn't have any relation for so many years, because he's having some superiority complex, and whenever he get time, she try to insult her, and all those things really make her more and more worried, and they even sleep in different rooms in their home, and whenever they came together. So this is the thing that we need to understand, and we need to go to the mental state of the patient to find out exactly what is happening inside. And frankly, she is having also some fibroid inside also. So your presentation was exemplary, brilliant one, and congrats for you for the same. Thank you.
Thank you
Hope,
very much.
hope we will be back with one more presentation here.
Yeah, yes. That's definitely we need it. Then now Dr. Lokmani Gupta, please. Come on, Dr. Lokmani Gupta, unmute yourself. Dr. Lokmani Gupta, yeah.
Yes, sir. Hello.
Yes, audible, please. Proceed.
Thank you, sir. Thank you for giving me a chance. A very nice presentation of Dr. Khushali ji.
Thank you.
And a very nice presentation, really, for the complaints very much happening nowadays because of the disturbed lifestyle of ladies. Is very much stressed, is very much under tension. And it is very well added by Dr. Shaji Kudial sir. The two things which were missing, he added it. Now my question is that role of aurum natrum. Aurum natrum is also very well used in such cases of fibroid. So what is your experience with this medicine? Please tell me.
So for me, Aurum Natrinatum, I had used it in some cases, but it hasn't helped me as much as Calcarea Fluor has helped me for fibroids. There is another presentation on women's health where I have got my fibroid cases in that. It's difficult to put everything in one presentation, but
Definitely.
I found Calcarea Fluor more useful, and hence I just stopped using Aurum Natrinatum, and I use Calcarea Fluor instead.
Thank you. Thank you.
Anyway, it's a nice presentation all the way. A lot of graphical representations, which I think it's a very exemplary one. I think you can help others, those who are interested to conduct certain research studies. These are what is desperately we are looking for. A lot of, especially the medicinal, the pictogram was very nice on pulsar. A lot of symptoms are covered in one area. At the same time, lacus is covered another type of symptoms. That we are all what is proved in the material medical once again reproved by that. What they have said 100 and 200 years ago was exactly the same. That is a very exceptional character of the homeopathic material medical. So it's a time to wind up our session. I call on our Farid Babakan sir to say the word of thanks, sir. Please.
Thank you. Thank you. Am I audible?
Yes, sir.
It is a very nice presentation, very useful and very relevant also. And congratulations to you, madam. I don't want to elaborate my words. It is very clear and self-explanatory. We want more presentation from you. You made the presentation in the context with the facts and also circumstances. Very good, excellent presentation. Thank you very much from the bottom of my heart and on behalf of all members of IFPH. All the best. Thank you.
Yes, in order to we want to restore the peace and harmony of every home. So through the medicines of us, everyone knows that what happens to a woman after the age of hovering around 40 to 60, creating problems to themselves and the society. It's a very important juncture at their life. So you are doing a wonderful job, Doctor. Thank you for the participation once again, and I appeal you to continue your participation with the IFPH. We are conducting the sessions for the last 355 days continuously and about to step to the Guinness Book of World Record, I think. So that marks the end of today's session, day 355. Now it is over to our Malayalam session. So, Dr. Tanesh, thank you.
Thank you. I have a small announcement to make. Thank you. Thank you for all those who joined today. We are reaching our 365th day, and in connection with our 365th day of celebrations, we are conducting competitions among the 6 homeopathic education institutions present in Kerala. So we are having 10 sessions of a competition for the students, and we are inviting cash awards to sponsor cash awards for the same. So those who are interested, please communicate with our secretary, Dr. P. Bhavirajan, for this matter. Those who wish to offer any sponsorship. For the first prize, we are offering 3,000 rupees. Second prize, we are offering 2,000 rupees, and the third prize, 1,000 rupees. So we have 5 competitions, and for PG and undergraduate levels. So we need 10 prizes, first, second, and third. So we invite sponsors. Please come forward to support these efforts of International Forum for Promoting Homeopathy to inspire and make our new generation students of homeopathy competent and passionate with the homeopathy. So we need your support. So I appreciate those who can come forward to sponsor our prizes. Our president, Dr. Ismail said, has already sponsored the first prizes. We already have few sponsors for our second and 2 third prizes. So remaining are still need to be sponsored. So we appreciate your generous mind to assist us.
Okay, thank you, Doctor. So over to Dr. Sanesh.
Thank you, Dr. Khushali, once again.
Thank you. Thank you.